Patients often ask, what's my story? How did I come to do this type of surgery? What's my experience with the disease, etc. So I grew up in East Tennessee. I went to college. I was a history major, and then I really was inspired by a series of physicians, mostly surgeons, who really set me on my path to wanting to become a doctor and going to medical school. And so I did some extra training to do all the basic sciences at Harvard, which was a great experience. Then I had the great pleasure of working with one of my lifelong mentors, a gentleman by the name of Dr. Gene Overholt, who's well published on esophageal diseases as well as Barrett's esophagus. And in the mid-90s, we collaborated to try to develop an optical biopsy actually for Barrett's esophagus, again, a disease I would go on to develop. And so with this, that propelled me into medical school. And while in medical school, again, I kind of knew I had a calling to become a surgeon. But I also looked back on my experience with Dr. Overholt, and he was very particular about who he would refer patients to surgically to treat this disease. And I kind of said, well, I want to be that guy that people feel comfortable referring to. And so I wanted to become an expert in this disease process and the surgical treatment of it. So I concentrated my efforts while a resident at the Baylor College of Medicine. I was lucky to study at the Michael E. DeBakey Department of Surgery. That was a great 5 years of my life. I went on to the Air Force and served at Nellis Air Force Base, being deployed to Iraq and Afghanistan several times, which was, of course, one of the great honors of my life to be able to take care of those patients. And then I came back to Texas. My wife is a physician she's an internist working as a hospitalist, and we wanted to come back to Texas. And it's been a great journey to, one, collaborate with our gastroenterologists here to create this amazing heartburn and acid reflux center. And I think that we really are doing a better job, hopefully, of treating the entire patient, all the aspects of their disease process, bring all the physicians as well as diagnostic equipment under one roof to really focus, laser focus our efforts on the patient and then really get a grip on this disease process and hopefully improve patients' quality.